Hello and welcome to Homeopathy Simply Explained. I am Petra Merker, a naturopath for classical homeopathy in Darmstadt, and in today's seminar on ME/CFS we will talk about concussions and head injuries in ME/CFS patients. I will present you a case with a history of head injury. We will talk about the topic of concussions and difficulties in homeopathic treatment, and finally we will take a closer look at the homeopathic medicine Helleborus niger. Let's now move on to the topic of head injuries, which are often found in the history of ME/CFS patients and the possible role in homeopathic treatment. If these head injuries have not been adequately treated in the past, blockages can form which can make further homeopathic treatment more difficult or bring it to a standstill. For the homeopathic medicine cabinet, lay people are recommended to administer arnica for a head injury, because arnica is a medicine that can absorb any bleeding that may occur and can also be used for concussions. However, we can see from this section that some other homeopathic medicines may be indicated for this problem. We see trivalent medicines like arnica, cicuta and hypericum. Divalent here are aconite, Helleborus and hyoscyamus. We had already discussed arnica regarding heart problems. Hypericum is particularly effective as an acute remedy for nerve injuries, and we have already taken a closer look to aconite together with opium in relation to shock. Helleborus and hyoscyamus are medicines that we will take a closer look at during the seminar. But monovalent drugs can also bring significant benefits to ME/CFS patients. To complete this, let's look at another category that could be important. The head concussion section is used for acute concussions, and the other section is used for complaints that arose or remained after head injury. Using our daughter as an example, we will now discuss an ME/CFS case with a history of 2 concussions. Our daughter suffered her first head injury on February 19, 2019. She twisted her ankle on a school trip and fell on her head on the tram tracks. She must have been unconscious for a short time because she only came to when she was spoken to by her classmates. The teacher obviously didn't notice about the incident. A short time later, that same day, she was doing gymnastics on a climbing frame at school and again hit a protruding screw with her right head. She suffered a laceration for this blow and suffered from memory loss, means amnesia. The concussion was accompanied by dizziness, forgetfulness of words when speaking, headaches, head fatigue and hiccups. Then the corona pandemic came and our daughter fell ill with laryngitis from the first Wuhan variant on March 1st, 2020. The strange thing about this cold was that the spot on her head where she had the concussion a year before also hurt. For me, these symptoms are now a clear sign that corona has affected the nervous system. The corona infection was also accompanied by dizziness, abdominal and headaches, swollen lymph nodes and ear pain. I had already discussed the case and its treatment in another video. A short time later, on March 16, 2020, our daughter complained for the first time of heart pain combined with persistent dizziness, headaches, ear aches and sore throats. She also had pain again in the tendons of her ankle, where she had already had a torn ankle. In the summer, our daughter was no longer able to swim laps in the swimming pool due to heart palpitations and the resulting shortness of breath. On October 23rd, 21, she again had a headache, dizziness, and heart palpitations during a flight. In addition, she became out of breath and easily startled when exerting herself lightly. On December 13th, 2021, she were hit by the second corona infection with the Delta variant, for which there is also a positive PCR that we see here. A second concussion wasn't long in coming either, because on May 2nd, 2022, she hit the edge of the swimming pool with full force while swimming backwards as part of school lessons. The consequence of this accident were complaints that lasted a whole month, during which our daughter was unable to do anything except lie down. She suffered from dizziness, headaches, and fatigue. However, after this month of bed rest, she was able to go back to her everyday life as usual and no longer had any symptoms. Due to the corona winter and the ventilation requirements, our daughter was constantly cold. The winter was very cold and sometimes down to -10 degrees. From November 17th, she caught a cold on November 25th, 2022. The freezing continued afterwards and culminated in swimming lessons, where she had to go into the lowered swimming pool water and contracted hypothermia there on December 2nd, 2022. As a result, our daughter developed blue lips, trembled, and had ice-cold legs for a week. On December 5th, 2022, she became acutely ill again. Around December 16, 2022, the acute illness turned into chronic fatigue, from which she never recovered. After each exclusion diagnosis, our daughter slipped further into fatigue until she was bedridden 24 hours a day, 7 days a week. Let's take a quick look at the symptoms that ME/CFS patients have and which our daughter had. The main symptom is PEM, post-exertional malaise, is exercise intolerance with delayed worsening of symptoms after low levels of exercise. Our daughter's health usually only deteriorated the next day after exposure. Another symptom is severe fatigue, a pathological weakness with pronounced exhaustion. Due to the massive weakness, our daughter had to be fed, had a weak voice, and could neither sit or stand. Another complaint is brain fog, which is associated with poor concentration, forgetfulness, confusion, and difficulty finding words. Our daughter also had these symptoms and was no longer conscious of life. The term awareness brought me a deep understanding of this symptom through our daughter's ME/CFS illness. First, let's look at how concussiousness is defined. When someone is conscious, the sensory impressions that provide the brain with information work. This information leads to an internal image, which then produces an emotional and cognitive response. ME/CFS patients often have a disorder of consciousness that can manifest itself either in a heightened, unfiltered concussiousness, in which sensory impressions are perceived without filtering, or in a lowered concussiousness in which there is mental dullness and sensory impressions are not perceived adequately. In a later video, I talk to our daughter about the problem of reduced consciousness, and I would like to briefly tell you how she described this condition. It was like seeing back then. I could see, but I didn't know what I was seeing. It's like when you look at me now, you know what I'm wearing, you know what I look like. It's like when you see that and you somehow know that the person in front of you is sitting there, but you don't recognize it. So you don't know what you are seeing. Somehow you can see, but you just don't know what you see. End of quote. So the brain doesn't process what it sees. It doesn't come into consciousness. The brain lacks the energy to process. Our daughter couldn't tie her hair behind her head either. Let's hear what she says about this, and I'll continue to quote. I had to see what I was doing. I couldn't do anything that I couldn't see. My brain couldn't process it. You see something, but you don't know that you see it. It's like taking a photo and the camera is broken, like a loose connection. Sometimes it does work. When you see what your hands are doing, you can combine it from your head because you combine it by seeing. If you blindfold yourself, you can no longer see or do anything. But if you now have a shell that has small holes, then you see it, but you see it faintly, and at some point the holes get bigger, then you see more, and then they get smaller again. End of quote. Our daughter also struggled with language changes due to the lack of energy in her brain. She could no longer pronounce "bird" correctly. Another symptom is sleep disorders in our daughter, which manifested itself in unrefreshing sleep, difficulty falling asleep and staying asleep, and sleeping multiple times during the day. There were also pains such as headaches and muscle aches. POTS, the postural orthostatic tachycardia syndrome, manifests itself in dizziness, rapid heartbeat, and a rapid pulse when the body sits upright. Other complaints include sensitivity to light, noise, and touch, and coordination problems. All of these complaints have to be reduced and thereby made bearable for the patient, and so we also need a way to alleviate symptoms in the homeopathic care of such patients. I will discuss with you how such cases can be handled homeopathically in the next videos. It was a really bad time for all of us. I was very desperate because I had to watch our daughter plummet into despair for 9 months and couldn't find the right homeopathic treatment to help her. Our daughter couldn't stand any touch or noise. First, I tried to treat the acute condition as usual by recording the acute symptoms and prescribing accordingly. Of course, I also took the cause of hypothermia into account. The next thing I thought of was a miasmatic blockage. Unfortunately, all of this didn't work. It wasn't until very late that I thought about the cause of the symptoms being due to the head injuries, especially since the head injuries all seemed to have been overcome without any consequences. No well-chosen homeopathic medicine brought any improvement, and I thought I wouldn't be able to solve the case. Since I'm generally not someone who gives up so easily, I continued to look for a suitable homeopathic medicine for our daughter, because giving up was not an option. At some point, I had the idea to take a closer look at the symptoms of the head injury from back then and to give a medicine based on these symptoms, even if the current symptoms did not match them. Here is the repertorization of the symptoms at that time. Here we see the two major homeopathic medicines, arnica and natrium sulfuricum, both of which I gave our daughter for her concussion. The first concussion healed relatively quickly. The second concussion took a whole month, and the symptoms were not positively influenced by either arnica or natrium sulfuricum. During the 9 months, I read a lot of materia medica and found what I was looking for in Kent. Kent writes, if arnica doesn't help with the concussion, you should give Helleborus. I didn't want to leave this untried and gave our daughter Helleborus niger C30, which turned out to be a game changer. The homeopathic medicine Helleborus niger C30 gave her so much energy back that she was able to get out of bed rest within a short time. We'll see what happened after Helleborus in the next video. In this video, I would like to take a closer look at the homeopathic medicine Helleborus niger with you. Helleborus niger, also known as Christmas rose or snow rose, is highly poisonous plant. It contains saponins and protoanemonines, but also helleborine. Poisoning is manifested by dizziness, diarrhea, and collapse. The plant used to be used for epilepsy or madness. The German Dr. Maddaus used Helleborus niger, among other things, for congestion of the brain and meningitis. The ingredient saponins has a cholesterol-lowering antibiotic, fungicidal, blood pressure increasing, and immune modulating effect. Protoanemonine is irritating to the skin and mucous membranes. It affects the kidneys and brain with paresis of the muscles, which can lead to respiratory paralysis. Helleborine, another active ingredient, is a heart poison similar to digitalis. In the homeopathic medical picture of Helleborus, we find drowsiness, anesthesia, and thus sluggishness of the brain. The spinal cord, nervous system, and psyche are also influenced by Helleborus. It is a medicine for the transition into unconsciousness. The eyes are partially open and staring ahead. The patient takes a long time to give an answer, and the influence of the brain on the body is reduced, which is why, among other things, the muscles fail. Patients have difficulty thinking, and attention and concentrating are reduced. Helleborus is an insidious disease. The patient experiences deterioration through comfort. The condition improves when the patient can think about their symptoms. This is exactly the opposite of the homeopathic medicine Medorhinum or Tuberculinum, which worsened by thinking about your symptoms. Our daughter didn't just need Helleborus niger as a single-agent therapy because she was occasionally experiencing fears and states of confusion every day that could not be influenced by Helleborus. We will discuss exactly what complaints these were and how they were treated in the next part of the seminar. I hope you got some added value from this part of the seminar. I would be pleased if you give me a thumbs up, leave a comment under the video, and join me again next time. Bye.